Hello everyone, my name is Clay Volkman and I'm the hearing provider here at Advantage Hearing in Greensboro, North Carolina. And I hope everyone is having a great day today. Today I just wanted to go over and kind of give you a general overview of what to expect when you come in for your first hearing appointment, or whether it be a hearing appointment a few years later after you've already had one. We're just going to kind of walk through the steps to give you an idea of what to expect when you come in. And we hope it's going to be a pleasant experience and something that you want to find out. So when you get here for the appointment, what we like to do is we like to go in and sit down, and we like to find out first your motivation for coming in, whether it be you're just curious to find out how your hearing is. I mean, you may not think you have hearing problems or any hearing loss at all, or you may think you have hearing loss, and we're going to try and figure out where you're at with that, and just kind of meet each other, kind of get a basis for where we're starting. So some of the things we like to ask is, if you are coming in and you feel like you've struggled to hear, we're going to ask you, where are you having these problems? Where is it? In church? Is it with your family? Do you struggle in front of the TV? We're trying to just figure out where we need to go and get a little background information. And a lot of times it's just talking back and forth to figure out, my husband or my wife, says I can't hear them when they're in this room or that room. That's the kind of info that's really important when we're first trying to figure out what's going on. So in addition to that, we're going to ask questions like, have you ever, some medical history, have you ever had a surgery on either ear? We need to know this kind of information in order to proceed with the test. It's very important background information. If you could bring a list of medications, sometimes there are certain medications that interact and can affect hearing. So we're going to ask a variety of questions just to get a good background, solid base on where we need to go throughout the testing. Some of those might be recent ear infections, any problems with your ears. So we're going to try and cover, it's not going to take a long time. We're going to try and cover that area and then move on and proceed with the test. So after that point, what I'm going to do is I'm going to take a look in each ear with an otoscope. It's an examination light that we use for the ear. It's going to allow me to see into your ear canal and hopefully be able to see a nice, healthy eardrum is what we're looking for. So I'm going to take a look in the right ear and the left ear. I'm going to make sure that we're, have a nice healthy ear canal so that we can proceed to the test. If some issues that may come up that we see in there commonly found are wax. Sometimes wax is in the ear for a reason, but sometimes it's built up to the point where it may be blocking the eardrum, or creating some kind of obstacle for us that we would need to address before we do the hearing exam. So hopefully, everything's good when we look in the ears, and we can proceed to the next step, which would be putting you in the testing booth. And when we put you in the testing booth, we always explain the test that we're going to do, which includes tests using tones and tests using speech. So the tests that we use, the tests that we do using tones, what we're trying to derive from that is the softest sounds you can hear at certain frequencies. And we're going to go from 250 hertz all the way out to 8,000 hertz. And we're going to test each frequency to see how you perceive sound at those frequencies and hertz. There's another test that we do that I don't want to get too much into today, but it's very important. It's called a bone conduction test. It allows us to test how sound is transmitted intracranially when you hear sound through your central nervous system and in through the bone. Okay, so when we gather that information, those two tests combined, we can put it together to give you a pretty good picture of what's going on with your hearing. So we've concluded the booth testing. We're going to move you out of the booth where it's more comfortable. We'll actually move you into another office where I can sit down, and across the desk I am going to explain your test results to you. And I want to do this in a manner where it's easy for you to understand. And I also, I just want to mention, if you come out of the testing booth and there is no hearing loss, you have normal hearing, of course we're going to tell you you have no hearing loss at this point. So we'll advise periodically, year after year, we advise to have your hearing tested. Make sure that your hearing is staying the same, and if there ever is an issue, we can address it at that point. But if you have normal hearing, of course, we're just going to let you know that and be on your way. Otherwise, if there is a hearing loss, I'm going to explain the audiogram, which is the test I just did in the booth. I'm going to try to help you understand from the low frequencies to the high frequencies if you have loss and to what degree that loss is. Okay, so once I do that, what I like to do next is I have a little system that I learned where I have, like, it's a picture and it kind of explains why you're having the type of hearing loss that you're having. And a lot of patients really like this part because it not only you're not just saying you have hearing loss, you're explaining what's going on to create this hearing loss. So I love that part. I hope that all my patients that come in here enjoy that part. They seem to. It gets them a little interactive in the testing and the explanation, and it lets me know that they understand what I'm saying. So once I finish with that part and I feel confident they understand the results of the test, I like to program a set of demo hearing aids that I have to their hearing loss and let them experience putting on a set of hearing aids. And at this point, this is kind of the fun part, where if you've never put on a hearing aid, if you've never even heard the sound of a hearing aid, you get to hear the hearing aid and you get to feel what it feels like to put it on. A lot of people will put it on and go over to the mirror and say, I don't even see it, because they make them so small and so out of sight now that it actually perks people up, that they're think, well, I can wear a hearing aid. It's not going to be this big vanity issue that most people have a hard time getting past. But anyway, so at this point, I put the patient in the hearing aid, talk to them about the function of the hearing aid, the programming. I keep it up on a flat screen TV so that they can watch along with me as we're going through it. Do a little quick testing with the aids on to let them see the difference from when they didn't have aids on compared to when they do. I even like to do a quick 25-word test where I give them 25 words to repeat back with their eyes closed, wearing the hearing aids, compared to the word test I gave them in the booth, and see the improvement with the hearing aids on. So it's a step that's kind of fun for everybody. It makes the patient interactive. It gives you an experience, and it's just a great part of the exam. So once we get past that part, Usually there's a lot of questions. We love that. Bring all your questions when you come for the test because we want to answer them. At this point, when we talk about, the hearing loss, they've experienced wearing the hearing aids, then we get into the part of talking about all the options for wearing hearing aids. We go through the styles of hearing aids, the different brands of hearing aids, and talk about all the options and the ways to wear them from, their insurance that they may have coverage on to the different ways to purchase hearing aids and all the options included in hearing aids and wearing the hearing aids. So it's interesting. There's a lot of aspects to it. Everyone always likes to find out, first, if you have a problem, second, how to resolve it, and third, they love to find out the new technology in hearing aids. There's a lot of Bluetooth stuff going on that just really dazzles people. So that's basically what is encompassed in a visit. And I know there's a lot of detailed stuff I've left out, but I hope I've given you an overview of what to expect. It's a very, very laid back process. Do not feel afraid of it because it's actually kind of fun. We're here in Greensboro. We're located right off East Wendover Street. If you know where Latham Park and the huge set of tennis courts sit, we sit right beside those tennis courts at Latham Park. And my name's Clay. I am here Monday through Friday, and I make special arrangements to see you if you couldn't make it Monday through Friday. So feel free to give us a call with any questions that you have. We'd love to see anyone who's even curious. Our initial exam is free, so don't hesitate to call to make an appointment. I hope everybody got something out of this. I hope you can use it, and I hope everybody has a great day. Thank you.